Hello everyone. Today we are going to discuss about another nursing diagnosis and care plan. Today we are going to see OCD, that is obsessive compulsive disorder, obsession, compulsion, and that can lead to disorder, that is obsessive compulsive disorder, repetition of activities and repeating and creating a compulsion to do that activities that leads to OCD. So what type of nursing diagnosis you can write for obsessive compulsive disorder? So the first nursing diagnosis is ineffective coping related to obsessive compulsive symptom as evidenced by excessive rituals and preoccupation with obsession. Second one is disturbed sleep pattern related to anxiety and intrusive thought. Third one is social isolation related to fear of judgment or embarrassment. I'm going to focus on the first one, that is ineffective coping related to obsessive compulsive symptoms as evidenced by excessive rituals and preoccupation with obsession. So that is our nursing diagnosis and this is our care plan. And in previous videos also we had a discussion regarding how to develop the nursing care plan. While writing your nursing care plan, you have to add all these columns: assessment, diagnosis, planning, rational, implementation, and evaluation. All right. So in assessment column, what you will write? You will write subjective data and objective data. In subjective data, you have to say what your patient is saying about his or her condition. And in objective data, what is your observation based on their discussion with the patient? So here, what is objective data? The patient is having OCD. So first you should know what is OCD. So OCD means obsessive compulsive disorder. So the patient complains that he is doing some repetitive actions and she or he can't stop it. And that is affecting her or his life and daily routines. So that is the complaint from the patient. Objective data, patient looks anxious and not maintaining eye contact. Patient looks dull and tired. So these are all the observations which you have got from the conversation and from the observation, okay, in between you and your patient. Then diagnosis, you can copy and paste the same diagnosis which you have developed already. Ineffective coping related to obsessive compulsive symptoms as evidenced by excessive rituals and preoccupation with the obsessions. And one more thing you have to add in the diagnosis session, that is goal. Okay, yeah, diagnosis column, that is goal. Okay, what is the goal here? The patient will demonstrate effective coping strategies and reduce the frequency and intensity of compulsive behavior. So the patient will, in future tense, you have to write the goal. Then you can write the planning session. In planning session, you have to write the planning. Okay, then you have to write the rationale for what you're doing that planning or reason behind each planning. Then implementation, that means after implementing the plan, okay, what is the result or how you have written that in planning. Then evaluation, what is the result? So first planning is do history collection and mental status examination. If you check my previous nursing care plans also, you can see the first and foremost planning is history collection, physical examination, or history collection and mental status examination. Here also the same thing. For what? Or what is the rationale? To understand the present status of the patient. Then in implementation means after completing that only you will write the implementation. Here what is the implementation? Collected history and done detailed mental status examination, or you can write done history collection and mental status examination. Here you can see do, here done, okay, or history collected, history collection. So past tense you have to write. Then second planning is assess the patient's level of anxiety, obsessional thoughts, and compulsive behavior. For what? To understand the severity of symptoms and also to monitor the changes or improvement in the patient's condition. And what is implementation? Regularly assessed. Here you can see assess in planning. In implementation, assess the compulsive behavior and observe the activities. Then third planning is encourage the patient to participate in CBT. What is CBT? Cognitive behavioral therapy. What is the rationale? CBT will help to understand the symptom. Also, it will help to manage their fears without doing compulsive behavior. So CBT is an effective technique, or cognitive behavioral therapy is an effective technique, okay, in reducing OCD symptoms by helping the patients to manage their fear without doing compulsive behavior. And what is implementation? Encourage the patient to do CBT, especially exposure response prevention. That is a type of CBT. Okay, or techniques of CBT. So you can write what you have implemented or what your doctor is implementing, okay, or what your psychiatrist is suggesting. That you can write instead of exposure and response prevention. Otherwise, you can write exposure and response prevention it's a method of CBT that you can implement, or you can encourage the patient to do that activity. Then next thing is planning. Under next planning, monitor medication adherence and side effects if the patient is taking SSRI. Okay, SSRI means what? Selective serotonin reuptake inhibitors. For what? What is the rationale? To ensure the effectiveness and safety. And in implementation, what you have to do? You have to monitor. In planning means what is implementation? Monitored side effects in past tense. Then educate good sleep practice. That's very, very important. That's a good plan. Okay, that we can implement in proper way and easy to implement also. So educate good sleep practice for what? Improving sleep hygiene can help alleviating anxiety as well as to maintain well-being. Okay, in implementation you can write implemented sleep schedule and what type of schedules you have implemented. That also you can specify. Also, I have added here stop caffeine intake and electronics before sleep. It's up to you. What are all the practices you have practiced that, or you have told your patient to practice, or that you can write there. Then teach the patient to practice coping strategies. That's very important. Coping with the regular stress of life will help to improve the mental health. Okay, that is a rational. Then started to practice mindfulness. That is a coping strategy. Then relaxation techniques and some hobbies. Okay, it depends upon the situation of the patient, guys. So this is another planning. Then next planning is encourage the patient to join support group activities, which is available in the hospital. For what? It can reduce the feeling of isolation. Okay, so encourage the patient to participate and provided additional coping resources and actively started participating in group activities. Then provide education to the family member. That is also very important. For what? To give an understanding and reduce the potential stresses. And in implementation, you can write after your education, the patient's family understood the need of family support to the patients for their recovery. Then another planning is plan and eradicate the behavioral discomfort from the patient. For what? To develop the healthy life for the patient. Okay, in implementation you can write started specific measurable goals and motivation to reduce the compulsive behavior. So these are all the planning I am giving for my OCD patient. Okay, and you can see the rationale and you can see the implementation. Then at last what you have to write? You have to write the implementation evaluation, right? So evaluation again in past tense you have to write. Okay, the patient demonstrated effective coping strategies and reduced the frequency and severity of compulsive behavior. The patient demonstrated effective coping strategies and reduced the frequency and severity of compulsive behavior. So in past tense you have to write. So this is the nursing diagnosis and care plan for OCD patient, and you can use this for anxiety patient also, guys. Hope you understand, guys. Thank you.